Immediately after stroke, a patient will be prescribed aspirin, and they prescribed high-dose aspirin, so it's 300 milligrams of aspirin. They're prescribed aspirin because it has a very good action of thinning the blood. It's called an antiplatelet drug, so it stops the platelets forming clots and sticking to the blood vessels. If the blood is thick and you get a blood clot forming in the brain, that can then lead on to a stroke. So they're given aspirin at a high dose to prevent that happening, so to make the blood thinner. Generally they're started on a drug called clopidogrel, and they will take that for life, and it's having the same action as aspirin, but it's been shown to be better than aspirin alone. If the patient has atrial fibrillation, they'll be started on a different type of drug to try to stop them having further strokes. And the drugs they're started on are called anticoagulant drugs. The most commonly used one is warfarin, but there are some newer anticoagulant drugs such as rivaroxaban and apixaban, which patients can be started on after a stroke. The antiplatelet drugs and the anticoagulant drugs, stroke patients will be on one of them after a stroke. Generally known as cholesterol-reducing tablets. They're statins, so atorvastatin or simvastatin or rosuvastatin. And in the normal population, they're used to reduce cholesterol, because if you reduce someone's cholesterol, you're going to reduce the risk of them having cardiovascular disease or a stroke. In stroke patients, they are being used to reduce their cholesterol, but it's also been found in research that no matter what a stroke patient's cholesterol is, if they're given a statin, it can reduce the risk of them going on to develop further strokes.
There's a whole number of medications that might be started for different medical reasons. It may be for diabetes, it may be to prevent yourself from having a fit or epilepsy, so there might be medications for those different conditions.
The kinds of medication that I have to take is a blood pressure tablet, one tablet that thins my blood, one to control my cholesterol, and also an antacid tablet.
And I'm on Ramipril for blood pressure, and I'm also on a thing called clopidogrel. I think I said that right. It's for like thinning the blood or reducing clotting, or it's not like a heavy anticoagulant like warfarin. Those are the ones that I'm on, and they're the ones that I take daily.
A lot of stroke survivors will be prescribed medicines to lower their blood pressure after the stroke. The reason this happens is because having a high blood pressure increases your risk of developing a stroke or any other form of cardiovascular disease, so it increases your risk of having a heart attack. The common types of medicines used after a stroke are medicines like Ramipril, which is a medicine from a class called ACE inhibitors, or they may be prescribed a drug like amlodipine, which is from a drug class called calcium channel blockers. And within both those drug classes, there are lots of other drugs. So the ACE inhibitors will generally end in IL, and the calcium channel blockers will generally end in INE.
It might be that your friend and yourself may have similar medical history, and it might be that you've forgotten your medications and you want to take your friends. It's very important that you don't do that. Your medications that are being prescribed to you are specific for you, the dosages are correct for you, and the types of medications are correct for you. So if you've misplaced your medications, speak to someone. It may be that might be able to give you an emergency dose at the hospital, but definitely don't take your friends, because that could cause you harm.